My name is Marty McDevitt. I'm a physical therapist at DMOS Orthopedic Surgeons. We're going to demonstrate the HUMAC isokinetic machine today. The first thing we're going to do is do an isometric test, which just basically Nate's going to kick out into the pad. Nothing's going to move, but it's going to give us a readout of how strong he's kicking. He's going to kick as hard as he can, hard as fast as he can. He'll kick. You can see the higher he kicks, the higher that line goes there. So we get right now it's just collecting the data. We'll go over that in a bit, but we can get an appreciation for how strong his knee is right now. The hamstring, so this time it's going to be pulled backwards. So with this machine, the benefit is we can really isolate the joint itself. So Nate's set up for a knee right now, but we can do ankle, hip, shoulder. We do the hip a little bit less often, so mostly it's for shoulder or knee first, then shoulder, then ankle. The benefit of isolating a specific joint is that it gives us an appreciation for how strong the injured joint is. Then we can compare it to his non-injured side. And the reason this is beneficial is doing things like squats and deadlifts and other strength exercises, leg pressings. You might be able to get an appreciation for how strong the leg is as a whole, but your body does a really nice job of offloading an injured joint. And so you may end up strengthening, let's say you hurt your knee, you may end up strengthening your hip and your ankle on that injured side rather than strengthening the knee. And a machine like this really gives us a nice insight into how strong that actual joint is getting versus the leg. So this time the machine's actually registering how hard he's kicking at every given point in that range of motion. So you can see how when he kicks out, it goes up a little higher. When he pulls back, it's going to be less. That's pretty normal for the knee. Go to ready, 5 inches as hard as you can. Good, pull, kick, all the way through, good, pull. And at the end of this, we'll get a readout of the average or the peak values of all these numbers. This will just be a little faster, so we can test at multiple speeds. Most of the research is done at the first speed, 60 degrees per second, and this little faster speed here. We can go as fast as we want to with it, but these are the most informative ones. We got 15 reps of that. But the research is pretty clear that there's certain metrics that place you at increased risk for a secondary injury, and that comes from having, let's say, less knee strength of the quadriceps or your thighs, and doing your regular exercises, you can't see that difference. This machine really highlights and isolates that well, so we actually see the percentage difference between sides. So it's much more specific, and it helps us to give the doctors information on increased risk for a secondary injury.